Okay, I wanted to take a few moments to just review figure 7.11.12 and point 13. And I'm hoping at this point you've had an opportunity to go through that list on the last power slide of chapter 7, just to get familiar with some of these terms and their definitions. So if you look at figure 7.11, this is showing you the effects of degranulation and synthesis of mast cells. So at the top of the diagram, it's basically showing you what can actually initiate mast cells. So the presence of bacteria and viruses, some injury, interleukin-1, an antibody IgE mediated mechanism, activating complement the C3A and C5A. So if you look at this diagram, you have on the left degranulation. So this is the immediate response. And you can see there's several mechanisms. So you can have what they call an eosinophil chemotactic factor, which eosinophils attach to the site. You promote phagocytosis. And then you have neutrophil chemotactic factors, which are attracted to the site and also promote phagocytosis. Or you have this histamine response where you have the vascular effects that I just previously talked about in the prior recording. Then you get a dilation or increased permeability and the exudation. Then you have the presence of the cytokines, specifically interleukin-4 and tumor necrosis factor. So interleukin-4 promotes B cell proliferation and antibody production, so that lymphocyte or the innate immunity. And then the tumor necrosis factor has the vascular effects of increased permeability and leukocyte migration. And then you have the tryptase, which promotes heparin, which heparin comes from the mast cells. So it helps to balance that clotting mechanism. So then you, on the right side, you have synthesis. So this long-term response where you have the presence of several proteins. First, the leukotrienes. Again, as we previously discussed, you get the vascular effects of dilation and increased permeability. Prostaglandins, again, the same kind of effect, also with pain, and they work with the bradykinin to cause pain. Cytokines, again, you have now the tumor necrosis factor in interleukin-13. So again, increased permeability, so you have that leukocyte migration, and then chemotaxis, which we bring in more neutrophils, and then we get B cell proliferation and antibody production. And then you also then get the promotion of growth factors, the VEGF and PDGF. So then we can start to have proliferation of the endothelial cells and connective tissue and smooth muscle, and therefore promote healing, because again, that is kind of one of the benefits of inflammation. So if you look at figure 7.12, this is showing you the effects of histamine through H1 and H2 receptors. And I'm just going to focus on H1. So H1, our target cells are smooth muscle cells, endothelial cells, neutrophils, and mast cells. So you can see here you have histamine attaching to the H1 receptor. And what happens is it connects to what they call GTP, and that gets converted to CGMP. So just, you know, GTP is guanosine triphosphate, and CGMP would be cyclic guanine monophosphate. And by increasing that level of the CGMP, you activate those target cells, and then you get the effects of histamine. So you get the contraction of the blood vessels or the retraction, so you can open up those endothelial junctions to promote the influx of the various inflammatory proteins. So you get that increased chemotaxis, the influx of neutrophils, and the synthesis of prostaglandin, which again promotes the dilation or increased permeability, but also brings on pain with the bradykinin. Then if you look at figure 7.13, this is the production of lipid vasoactive substances by mast cells. So again, when you have this enzyme, which is called phospholipase A2 when it combines with what they call the PAF, which is platelet activating factor. You get an enhanced inflammation, eosinophil chemotaxis. So eosinophils come on the scene, vasoconstriction, bronchoconstriction, platelet activation, so clotting, and then you get the vasodilation, the increased capillary permeability. But then also, if that enzyme, the phospholipase A2, attaches to the arachidonic acid, then you get two different other processes. So you promote the presence of the cyclooxygenase, which attaches to the PGD2, which is the prostaglandin D2. And then you get the enhanced inflammation, smooth muscle contraction, bronchoconstriction, increased capillary permeability, and increased vasodilation. But if arachidonic acid combines with 5, the lipoxygenase, then you get a series of these lipid proteins, LTA4, LTC4, LTD4, LTE4, which then gives you those same effects that I just went over. And then if you go to the right and you yield LTB4, you get enhanced inflammation and that whole process that we just talked about in the prior video, and then chemotaxis, the influx of the neutrophils. And if you go over to figure 7.15, this is just a diagram that shows you everything that I just kind of mentioned in regards to now and in the prior PowerPoint recording, showing you the chemotaxis and what that looks like, and phagocytosis and recognition and attachment. So I would encourage you to look over this diagram. Sometimes it's very helpful to have a picture for some of these words and these processes. Thank you.